The story I want to tell you today begins with bad advice. In my final year of medical school, I was looking ahead to my pediatric residency, and I ventured to broach with my faculty advisor my interest in environmental advocacy. I'll never forget, she rolled her eyes at me and kind of shook her head and said, "You know, you really need to be focusing on learning how to be a doctor right now. You're going to be working 80 hours a week. It's going to be all you can handle just being a resident, without all this extraneous environmental stuff that you're talking about." And she was right in that I did work 80 hours a week during my residency. For those physicians in the room that did their residency before work hour restrictions, that may not sound like much. But for me, working 30 hours straight every 3 or 4 days was enough to make much of that time pass in a bit of a blur. Still, despite my sleep deprivation, it was pretty hard, growingly difficult, to ignore the disconnect between the environmental externalities created by my hospital's operations and our health mission. So when I finished my residency, I worked with my health systems leadership to create our sustainability office, whose mission was and still is to integrate environmental along with social and economic considerations in all of our operating practices. Well, at that time, a supervising faculty member of mine in my clinical department of pediatrics said, "You know, this sustainability thing that you're about to do really has nothing to do with being a doctor. You can keep up your clinical skills if you really want," and I did want, "but really, by making this choice, you're choosing to leave your academic medical career behind. And eventually, you're going to have to choose once and for all, and you'll probably become an administrator or something, really not a doctor at all anymore." And so that advice was so similar to what I'd heard back in medical school that it got me thinking, like, what counts as being a doctor? Is it the knowledge and the technical expertise that it takes to take a good history, do a physical exam, make a diagnosis, prescribe medical treatment? Well, certainly all of that's critical, but what is the point of all of those skills? Why did we enter this profession in the first place? For my part, and I would venture for many of the clinicians here, I would say that I went into medicine because I wanted to help my patients get and stay healthy. And I started to wonder if I could do that by confining my definition of doctoring to that 15-minute interaction that I get with my patients in my clinic or in the hospital. One of the patients in my practice is a 6th grader who has moderately severe asthma. He's also obese, which a growing number of kids in this country are. And so I talked to him and his family recently about, eating healthier. Stop watching so much TV. Get outside and play this summer. Join a sports team. But I had to put a little asterisk next to all of that, right? Because on ozone action days, I don't want you to go outside and play because the air quality could provoke a dangerous asthma exacerbation in this child. So here you have a situation of a child who I'm telling to do what kids should be doing in the summertime. Get outside and play. Join a sports team. For this child in particular, who is obese and whose physical activity is critical for his health, I have to tell him, but you know what? Don't do that on some of these days in the summertime because we as a society have failed to ensure that you have clean air to breathe. I believe that access to health is a social justice issue. And we environmentalists understand that environmental health burdens are borne disproportionately by vulnerable populations, including children, including communities of color, including those living in poverty. Those characteristics describe most of the patients I take care of in my clinic. In Cleveland, where I practice, over 1 out of 5 African American children suffers from asthma. That's about twice the prevalence of pediatric asthma in the country overall. Wait for my slide, there we go. Do y'all know what that first picture is up there? That is a famous picture of the burning Cuyahoga River, which is the river that runs through Cleveland. That is a picture of its fire in the 1950s. And at the time, it was far from the only river in the United States that was polluted enough to catch on fire. At the time, rivers were catching on fire all over the place. But actually, it was the iconic images of the burning Cuyahoga that ultimately really ignited the modern environmental movement. The second picture is also a Cleveland reference, actually. That's a picture from the Lorax. This is the scene where the humming fish are escaping the water that was so polluted by the Onceler's factory. You might remember it. Well, the original lines from that scene in the Lorax were inspired by the dire pollution in Lake Erie. At the time, There were images of dead fish and oil slicks washing up on the shores of Lake Erie and the other Great Lakes that had really captured the shocked attention of the nation. And so I'm going to read the original lines to you. I'm sending them off. Oh, their future is dreary. They'll walk on their fins and get woefully weary. In search of some water that isn't so smeary, you can tell where this is going. I heard things are just as bad in Lake Erie. Those images of the dead fish and the oil slicks really galvanized the newly created Environmental Protection Agency during those years. And so for me, that burning river, the dead lake, I don't view those as dark stains in Cleveland's history. They were really emblematic of a national crisis and ultimately ended up being a powerful call to action for a sorely needed national movement. Now we have a new call to action that also has Cleveland sort of in the center of the circle. There have been a number of health statistics in Cleveland that have received national attention recently. There was a recent New York Times article that some of you may have seen that highlighted the fact that our rates of lead poisoning in children in Cleveland are twice as high as the rates of lead poisoning in Flint, Michigan at the peak of the Flint water crisis. In some of the Cleveland neighborhoods where I practice, up to 1 in 4 children who are tested have elevated blood lead levels. We all know that lead is a neurodevelopmental toxicant. It causes problems in school, difficulties with learning, attention problems, later on aggressive behaviors, and even criminal behaviors later in life. There was also a few years ago an HBO special that highlighted the fact that still in this country, one's zip code determines to a large degree one's health. And the example that was used was from Cleveland. In one urban Cleveland neighborhood near where I practice, a baby born today has a life expectancy of 64 years. Just 8 miles away, in a more affluent community, a baby born today has a life expectancy of 88 years. That is just staggering to me, a 24-year difference in life expectancy with just an 8-mile difference between those two babies. As clinicians and as health professionals, those kinds of statistics should make us seriously question ourselves. Certainly for me as a pediatrician, I do some serious soul searching when I think about those statistics. What am I doing and what are we doing? What is our collective impact if the people we take care of have health outcomes like those? We have a growing understanding that only about 10 to 20% of our health is determined by access to excellent health care. 80 to 90% of our health is attributable to social, economic, and environmental factors. These so-called social determinants of health are really all about the environment where we live. In fact, I would put to you that social and environmental determinants of health are so intertwined as to be essentially indistinguishable. This burning river and this dead lake are, instead of being a symbol of a national crisis, have become a symbol of some of the greatest successes of the environmental movement. That picture there on the left is taken from the Cuyahoga Valley National Park today. Today, the Cuyahoga River is home to fish species like steelhead and pike and a growing biodiversity that's really reflective of the incredible rehabilitation that has restored this river to health. And the same is true of Lake Erie. That's a picture of beautiful Edgewater Park in Cleveland, and you can see our gorgeous skyline, which reminds me that some of the most vibrant examples of urban revitalization are taking place in Cleveland and other Rust Belt cities today. Like my city itself, my patients inspire me all the time with their triumph over adversity through sheer strength and force of will. One of my patients is a 4-month-old baby whose mom grew up in foster care where she was abused. When she got pregnant, she was addicted to drugs. She entered recovery, and she's still in recovery today. She got a job as an hourly wage worker in a local fast food joint. She went back to work when her baby was only 4 weeks old. She's taking care of this baby by herself. She found a daycare center not far from where she works, this burger joint, so that on every one of her 15-minute breaks, she can race over and breastfeed her baby. Her baby is thriving today, and I just find her resilience and strength incredible, especially having parented young children myself. It's incredible. I'm inspired by my patients every single day, and they deserve a doctor who is committed to being their partner for their total health and well-being, far beyond the walls of our clinic. Those of us who are engaged in environmental advocacy and healthcare can find it to be a lonely business sometimes. Certainly when I found it to be lonely and discouraging when physician mentors whom I admired and respected dismissed my work as having nothing to do with being a doctor, who advised me to keep my head down and engage in the business as usual practice of medicine. Gandhi once said that many people want to punish you for speaking the truth, for being correct, for being you. Never apologize for being correct or for being years ahead of your time. If you are right and you know it, speak your mind. Speak your mind. Even if you are a minority of one, the truth is still the truth. Being here reminds me powerfully that I am far from a minority of one in advocating for healthcare sustainability. But still, all of us are swimming upstream a lot of the time. But the thing is, upstream is exactly where we need to be. Many of us are familiar with the parable of the villagers rescuing the babies from the river. Briefly, the story goes like this. A group of villagers sees a baby floating by in a river, and one of them dives in and rescues the baby. And then more and more babies start floating down the river, and more villagers are diving in faster and faster to rescue the babies and bring them to shore. Two villagers stop suddenly and begin running upstream. And the rest of the group asks them, "Where are you going?" And they say, "We're going to find out who's throwing the babies in." And what we are doing, I would argue, in the healthcare sustainability movement is swimming upstream together, which is an incredibly powerful thing because when we swim upstream together, we can ride each other's wake and we can even change the direction of the current. When we look upstream, it's obvious that our healthcare facilities must be safe and non-toxic and creating only positive externalities. It's obvious that our operating and purchasing practices have to support health and social justice. It's obvious that our heads have to be up, not down, our eyes focused out on the horizon, so that we can understand that urban planning is a health issue, transportation infrastructure is a health issue, energy policy is a health issue, food systems are a health issue, chemicals management are a health issue, and all of us as clinicians and healthcare providers belong in those spaces and not just in the momentary time and place of our 15-minute clinical encounter with our patients. It's become increasingly clear to me that as a doctor, I feel required to be in those spaces. When I'm in clinic, of course the patient in front of me has all of my attention, but I would be doing them a disservice if I acted like they were in a vacuum, if I kept my head down and failed to notice all of the determinants that contribute to their health and advocate on their behalf. So now, my head is up, my eyes are open, my arms are extended so that I can embrace my patients, the communities I serve, my collaborators, and my fellow champions who, like me, are speaking their minds about social justice, about the radical notion of delivering health care, not just sick care, and about the fact that environmental stewardship is a prerequisite for all of that. The truth is the truth, and I'm honored to be speaking it together with all of you. Thank you.